Robert Davis with Active Health Complete Relief Care, and I am here to explain to you how Trigenics, our non-surgical operation for the knee, helps to relieve and eliminate chronic degenerative knee pain. Trigenics is a non-surgical operation. It's a neurological treatment system that resets the communication between your brain and your body. In this case, we're talking about the knee. So your knee has nerves connected to the muscles that are controlling it. In order to walk properly, when you take a step, there has to be proper energy going into the muscles that are controlling your knee. So there are two important nerves to take into consideration when you're looking at knee pain. One of the nerves is your femoral nerve. This nerve right here branches off the lower part of your back, and it innervates or gives power to the muscles that are extending your leg. So when your leg is extending to take a step, these muscles have to engage. Well, before you take a step, there's another muscle that is controlled by a branch of your sciatic nerve. It's called the popliteus muscle. It's a very little muscle behind your knee, and in order for you to work properly, your knee has to unlock. So your knee is a hinge joint. If you lose tone, if the tone drops because there's damage, there's a lesion along the pathway causing damage to the tone, what's going to happen over time? You get a sloppy joint. And sloppy joint means it's going to put stress on ligaments, and in order for your body to tell you something's wrong there, you're going to start getting pain and you're going to start limping. So it's good that we have these protective mechanisms. For instance, if you put your hand on a hot stove, you want to make sure that you know to take it off. So the pain that you're having in your knee is a protective mechanism. So what we do a full evaluation. If you come into our office, for $60, we will do a complete neurological examination. And I guarantee results in 2 visits, or I won't accept you as a patient. So what I mean by that is we're going to rule you in or out of care in 2 visits. So please take down our phone number. It's $60. You'll get a complete neurological examination. Thank you for watching. Jane, I want to thank you so much for coming on the program today. We have quite a history together. Mm-hmm. And if you can, I want you to tell me what brought you into the office. What problem were you having?
I was having a problem with my knee.
Okay.
What happened was I twisted it, and then I got a torn meniscus from that, which I didn't know at first. I had to go to an orthopedic surgeon and have surgery, which was successful, but the initial injury caused a lot of swelling, a lot of pain, very acute pain, and I couldn't walk. I couldn't put any weight on my knee. So I was hobbling around with crutches, and once I went through the surgery, a lot of the acute pain went away, but of course, they want you to go on painkillers, which I was
Did you go on them?
I didn't, because I really try to avoid any kind of medication if I can.
Okay.
But it was sore, and I couldn't walk or stand for any length of time. And then I got through the 6 weeks period, and I do have a part-time job where I stand, work about 15 hours a week. And I was able to go back to work, but I had a knee brace.
I got you.
And by the time I would get off work after 4 hours of standing, my knee would be so swollen that the knee brace was like constricting me. I had to go home, elevate my leg, and put ice on it. But I bared through the pain.
I remember you coming in the office because I was treating you for your neck and back.
And lo and behold, when I got through the healing process, you came up with the Trigenics treatment. And you gave me one treatment, and it was still painful at first, but the pain went away, but the movement was tremendous. I could actually do a squat, and prior to that, I couldn't even bend my knee. Just sitting in a chair like this with my knee bent was painful. So what that did was it enabled me to, because they encouraged me to do physical therapy, which I did some limited, but I couldn't do very much. So this enabled me to exercise, which I needed to continue the healing process. And I joined a gym and got a personal trainer, And now I go 3 times a week, and
Right.
I've continued this. Now this, your original treatment was in December
Right.
of last year, and I followed up with another treatment last month, and I can do almost anything. I went back to my job, and I have minimal swelling. I mean, sometimes if I'm on my feet a real long time, but it's nothing. I don't have to wear a knee brace. I can walk. I just went on vacation last month to Illinois and saw my 2 grandchildren, and they ran me around for 2 weeks. So it really improved my, my life, the quality of my life.
That's awesome. And do you remember the first time when you came in and I said I have a technique, a non-surgical operation that I want to do on your knee? Do you remember how hesitant you were?
Well, sure, because there's always doubt. It's like,
Sure.
I had no idea what you were talking about. And, we're always skeptical,
Sure.
Especially when you get to be my age, you're a little skeptical when some young man says he's going to, do this and that to your knee. And I was in a certain amount of pain, not as bad as it was in the beginning, but I'm like, I don't think I want you to touch my knee. Just stay away from it,
And how long did that first treatment take? That you show that dramatic improvement? How long would you say?
It was immediate. I was in shock, really, that I had so much relief that quickly. It just blew me away.
Excellent. Can you do me a favor? And there could be people out watching right now that are experiencing chronic degenerative knee pain, and they're either faced with a replacement surgery, or they're taking pain pills and getting injections. Because those are the people that I see that aren't successful with the replacements or the injections or the pain pills. The people that have success and their pain's relieved, I don't see them in my office. So if you can look at, I believe it's that camera, and just tell anybody that might be experiencing pain and can't get it resolved, what would you recommend that they do?
Well, I would certainly recommend they try this treatment. When I did have my surgery, they went in and they even gave me the copies of the pictures of what's in my knee, because nowadays they put the little cameras in there.
Right.
And I'm not a candidate for knee surgery because I do have cartilage in there. I have arthritis, so I'm kind of in limbo. I can't do a knee replacement, but I don't want to be in constant pain.
Sure.
And I want the mobility, because you don't realize until you can't walk how limiting. I mean, to get up to go to the washroom or to get up and fix yourself something to eat was, difficult, So I do recommend it, absolutely. At least give it a try.
Thank you very much for coming on the program. If you or a loved one are suffering with chronic degenerative knee pain, please take down the phone number below. If you're suffering with knee pain and if you've tried injections, you're taking pain pills, or you might be facing a knee replacement surgery, take down the phone number. I guarantee results in 2 visits, or I don't take you on as a patient. If you mention this program, the cost will be $60. We will do a full evaluation. Our normal fee is $250. So for $60, I can rule you in or out of care. Thank you very much. Hi, I'm Dr. Robert Davis with Active Health Complete Relief Care, and I have Yvonne here today. Yvonne, thank you for taking the time out and discussing your case with us.
Yes.
So I'm going to just ask you a few questions. The reason why you came into the office is because you were having problems in your knees.
Yes.
So could you look at the camera and just discuss the problems that you were suffering?
I was having a lot of pain in my knee, my left knee. And one day I was laying in bed watching TV. Then I saw the commercial on Dr. Davis, and my husband was there, and then he goes, well, let's give him a try. I said, okay. Then he called first. He made the appointment for me to come see Dr. Davis. So when I came here, I was in a lot of pain.
Yes, you were.
I was suffering a lot. Nobody knows. I always tell my husband, you have no idea how much pain I'm in. Then he said, let's go see Dr. Davis. So I came in. Dr. Davis was so nice with his staff when I came. And he asked me what was the problem, and I explained it to him. And I've been seeing a doctor. He told me that I had a tear in my knee,
Right.
that I need to have surgery to repair it. But I was thinking about it a lot. I didn't want to do the surgery.
I know, you had a brace on and
Yeah,
trying to do everything possible not to have the surgery.
it's really hard to go to bed in pain, waking up in pain, every day 24/7. I'm not kidding you. It was terrible. Nobody has no idea until I came to see you. Now I can say that I'm feeling much, much better. And I thank you very much with your staff. You're so very nice.
Thank you.
Very nice people.
So can I ask you a question?
Sure.
There's other people suffering with knee problems, and they're being told that they need injections, they need drugs and surgery.
Mm-hmm.
And a lot of times it's not necessary. Sometimes it is necessary to have surgery on your knee, but in a lot of cases it's not. So what would you tell somebody out there to do if they're suffering with knee pain, they're not really sure what to do, and they're being told different things? Can you look at the camera and just tell
Sure.
them?
They can call you too, like I did, and come see you. Have a second opinion, because it's really helpful.
So I'm going to ask you another question. What did you notice? So you came in with a brace on. You were hobbling, and I remember Becky brought you up and down the stairs.
Yes.
Okay, so we wanted to see where you were before you got treated.
Mm-hmm.
And so how much time did I spend with you on your knee, you think, the first time? How many minutes? 15?
I think so. 15 minutes?
No more than 20, right?
No.
So I spent 20 minutes working on your knee. And when you walked outside, what was different walking up and down the stairs? We actually have a video of that we'll show. But tell them what was different after just 15 minutes of me working on your knee.
I could walk better. I could go down downstairs without any problem. But before I could not do that. I could not do that.
That's fantastic. I'm very happy we were able to help you.
Yes.
So I'm gonna just thank you for coming on the show. I know you're going on vacation.
Yes.
So we're actually doing the infomercial, so I'll have a beard for this one, but tomorrow I'm in shape. So you have a nice time on your vacation, and I'm so happy that I was able to help you, and we're going to keep working to make that knee just perfect, okay?
All right. Thank you
All right,
very
thank
much,
you.
Dr. Davis.
You're welcome. So if you or a loved one is suffering with chronic degenerative knee pain, and they've been told they need drugs or surgery, or they've had injections already, they might have even had a surgery, please take down our phone number. Our practice is Active Health Complete Relief Care, and my name is Dr. Robert Davis, and the number should be on the screen right now. Thank you very much for taking your time to watch our show. God bless. Hello, I'm Dr. Robert Davis with Active Health Complete Relief Care, and I am here with David to discuss the problems that he was having with his knees and what we were able to do to help him. David, can you please explain the issues you've had with your knees over the last couple, 3 years, and tell whoever might be watching the problems you have and what you've done to try to resolve it, and then the improvements that you've seen since you've been in our office?
Yes. Rob, I've had my knees, first of all, the first thing I did in an accident, I tore my Achilles tendon. And that caused me to be off of my knees for my right knee for a long time. 10 to 12 weeks, I wasn't able to put any weight on my knee. And so during that period of time, this leg atrophied quite a bit with no exercise or anything. And so as I was getting back to walking, I limped a lot on that knee, which put a lot of more pressure on my left knee, and I ended up tearing the Achilles tendon, the Achilles,
I remember.
the meniscus in my left knee. And so I've just been, then whenever this one healed up and I started doing therapy on building the muscle back in this one, and I was working on, limping on this one, well now the meniscus tore in my right knee. And so it's been kind of a downhill slide with the care of my knee. And I've always been very active, did a lot of walking. I have been a runner in my life and done a lot of activity. I'm working every day out on some land that we have in Alva. And I'm not able to do any of that anymore because my knees have a lot of pain. I've had a lot of different things done to my knee. I've had some surgery done on the meniscuses, not surgery, but actually orthoscopic procedures, and so they could trim them up. I've had all kinds of injections. One of the most effective things I've had done is I had vein surgery on my legs.
Right.
And all these things give me temporary relief. But on the other hand, I'm very cautious about saying, well, my knees are a lot better, because it's always temporary.
Sure.
And so I come back, I came to you, and because I had pain in my back, and I asked,
Right.
you told me, well, did you know that I work on knees?
You were just coming in to get your back work.
Yeah, because I've
been
been to you periodically in the
Right.
past for that. And you said, well, did you know that I work on knees? It's a thing that I have kind of specialized in.
Yes.
And so I'm taking the procedures that you are suggesting for that, and my knees really are getting better. I'm able to walk up and down stairs now better than I have in 3 years.
That's awesome.
And but I still feel a lot of weakness, and I know that I have a long way. But the journey, I call it a journey,
Mm-hmm.
and it's a journey of my healing, and I feel that the journey is getting better.
That's excellent.
That's my hope.
So when you came in that one visit, and then we worked on your knees, and over the when I worked on the I forget which knee, it was the left or right knee, but then you were walking up and down the stairs. And what did you notice different, like walking up the stairs? I remember you had to do 2 feet on each step, and then you were able to take a full step. So there was a difference there. And your legs need to get stronger because you haven't worked them in a while. So what was the change that you noticed?
Yeah, you always when you're climbing steps and you've
Right.
got a problem with that, you always go up one step with the good knee,
Right.
and you drag the bad knee up.
Right.
And so the bad knee the worst knee I have right now, both of them are still painful, but the worst knee I have now is my left leg,
Mm-hmm.
and I'm able to take both steps now. And so I think that the journey is getting better. I'm still optimistic because I've done so many things
Right.
that seem to work, and then all of a sudden, here I am
Sure.
back on crutches.
Well, you're not on crutches now.
No, but I've spent a lot of time on crutches, braces, everything. I'm riding a bike every day. Of course, I've been doing that for a couple of months, riding a bike and swimming.
Sure.
It's a kind of the kind of exercise that I can do that is tolerable.
So can I ask you to kind of reach out to anybody that might be watching right now, and just tell them, if they're suffering with knee pain, what advice would you have? From your experience in my office, how I evaluated you, the treatment that we did, it's a non-surgical operation, but it's non-invasive. So what would you say to somebody that's suffering with knee pain that might be looking to a lot of things that you've already tried?
Well, I think this is a procedure that seems to be working. It's something that I would advise somebody to at least try.
Perfect.
You know,
Thank you very much for your time, David.
I don't give medical
appreciate it.
advice, but
I know you don't.
but
You're a tough
it's
customer.
something to try. To try.
But I really appreciate your time this morning coming in.
All right.
If you or a loved one are suffering with chronic knee pain and you're facing surgery, or you've had injections and you're taking pain medication and it's not resolving, please take down our phone number, give us a call. We guarantee results in 2 visits, or we don't take you on as a patient, meaning that we're going to rule you in or out of care in 2 visits. Thank you for watching. Try to step up, the one that's bothering you.
I have to catch it. I make a real quick step to catch it.
And the other way, you're okay.
Yeah.
Okay, just spot him as he comes back down. Okay, all right. Okay, so that's your left. All right. So what we're gonna do is we're gonna do trigenics on your left knee. I'm gonna have you do that again.
Let's see you go up and down the stairs one more time. Show us what you got. And back down, David. And what would you say the pain is now?
I have no pain.
0 pain.
I have very little pain. I'm being real careful.
So Yvonne, if you could do a squat for me. Okay. This is Yvonne's first squat after her first trigenics maneuver. Show us what you got, Yvonne. Okay, one of Yvonne's biggest problems is going up and down the stairs. So Yvonne, if you could come down the stairway, make sure you hold on to the railing. Explain to me where it's hurting. It's on the inside of your knee? Okay. Okay, Yvonne, we've done 1 trigenics. Let's try the stairs again. Okay, turn around and go back up. What do you feel now? What is the difference?
Oh, that's better. No, I can't say no pain, but the way I was.
I am Dr. Robert Davis with Active Health Complete Relief Care, and I am here with Jeanette. Hello, Jeanette. Thank
Hello.
you for taking the time out this morning to spend with us. What I'd like you to do, if you could, explain the reason why you came into my office, the problems that you were having. I know you had some fears of what that might lead to if you didn't get the knee pain resolved. So could you just tell the people who are watching the experience that you had prior to coming in the office and then after you came into the office?
Sure, I'd be happy to. I've had knee problems, I would say good 25 years, and I actually sort of thought my legs were deformed because, like, getting on a horse,
Right.
it was very difficult.
Right.
Riding a snowmobile, everybody puts their feet back. I couldn't, I had to put mine forward. So I've always had knee issues. And I don't know how many people down here know what the sport of curling is, but I was a very, very active curler. I curled 3 or 4 times a week.
Wow.
Tournaments, bonspiels, championships.
That's cool.
And I had to quit curling because of my knees. I could no longer get down and do it correctly. I couldn't squat,
Mm-hmm.
couldn't kneel on the floor. They were swollen most of the time, and they were painful.
Right.
So I kept thinking maybe I should go to an orthopedic doctor and see if I'm bone on bone. But I never really felt that I was. I felt personally that it was
Right.
muscular.
Right.
I really did. And I happened to see your ad on Facebook.
My lovely face on
And I'm going,
Facebook.
wow, that's exactly what I was thinking, that it's muscular.
Connection, sure.
Yes, and of course I like the no surgery, no injections, no medication.
Right.
So I came in and I did have relief immediately
Right.
with the squatting.
Right. So we did the before. I think I might be able to put that video on the commercial, or it's on my YouTube channel. But yeah, so you came in and we did that one treatment, and you were squatting so far down, maybe
Yes.
a 3/4 squat, and then you were going all the way down.
Yes,
And how long weren't you able to do that?
20 years maybe.
Right.
It's been a long time. It's been a long, and I didn't ever take prescription pain meds, but before I shoveled snow, I always took aspirin, and before I curled, I always took something just to
Sure.
keep the pain down. And now I can even crawl on the floor. I happen to know
That's
that
great.
because I was getting something off and I fell over and I had to crawl to the
That's-
table and get myself up.
That's fantastic.
So the swelling is gone. As far as differences, I can do the stairs,
Right.
not one at a time, but
Sure.
stairs. I don't have to lean on my grocery cart anymore. I can
Yes.
push it standing up.
Yes, that's. So
It sounds kind of weird, but I used to always sit down when I took a shower, and I don't have to do that anymore.
Oh, that's great. I'm glad.
So I'm very happy.
Great. And I appreciate you coming to the show. You're a pleasure to treat in the office. We love having you in here.
Well, thank you.
And if you could, just reach out to the people that are watching, because there's a lot of people suffering. I mean, you walk in to Publix or any of the grocery stores, and you see people just leaning over their shopping carts because they have such, they're trying to take the pain off their knees.
Take the pressure off.
So if you could just look to that camera over there and just explain, just give people advice. What would you tell them to do if they're suffering with knee pain and they're being faced with surgery or injections?
Well, my advice would be if you're suffering with knee pain and you're not real thrilled about surgery or
Yeah.
whatever, I would strongly suggest that you try this method of relieving your pain.
Thank you very much. I appreciate you, and thanks for taking the time this morning.
You're welcome.
If you or a loved one is suffering with chronic degenerative knee pain, please take down our phone. Or you've had injections, you're taking pain medication, and it's not being resolved. We have a special today for $60. If you call into our office, I am going to conduct a complete neurological examination. We do guarantee results in 2 visits, or we rule you out or in of care. So that means what we're going to do, we'll rule you in or out of care in 2 visits, or we don't take you on as a patient. Thank you for watching.